thyroid gland, the vertical extension, it is from C5 to T1 vertebra. It is from C5 to T1 vertebral level. In relation to the thyroid cartilage and the tracheal ring, it extends from middle of the thyroid cartilage to the fifth tracheal ring. Now coming to the isthmus extends from second to the fourth tracheal ring. Remember, the sternothyroid muscle coming from the originating from the sternum and attaches to the oblique line of the thyroid cartilage prevents the upward movement of the thyroid swelling. Any thyroid swelling, upward movement is prevented by sternothyroid muscle. So more lateral to that is the sternohyoid muscle. Thyroid gland is attached to the cricoid cartilage along with the ligament, with the help of the ligament called as ligament of Berry, which is a condensation from pretracheal fascia. It allows the normal upward movement of thyroid gland during deglutition or swallowing. The pretracheal fascia covers whole of the thyroid gland. Now coming to the capsule, there are two types of capsule, true capsule and the false capsule. True capsule is a condensation of gland's own stroma, while the false capsule comes from outside. For example, in case of thyroid, it comes from where? Pretracheal fascia. In case of prostate, it comes from pelvic fascia. Now coming to the cleavage plane, in case of thyroid, is between the false capsule and true capsule because the venous plexus are within the gland, thyroid gland stroma. So the thyroid gland is removed along with the true capsule. While as in case of the prostate, it is removed. The true capsule is not removed. Why? Because it is present, the venous plexus are present between the true capsule and false capsule in case of prostate. So the true capsule is not removed in prostate. The plane of cleavage plane is within the gland stroma. Now coming to the transverse section of the neck, to see the thyroid. Thyroid is related laterally. Lateral relation of thyroid is sternothyroid muscle, which is the closest relation. Closest lateral relation is the sternothyroid muscle. Above that is the superior belly of omohyoid and sternohyoid muscle. The outermost is the sternocleidomastoid muscle. Now coming to the medial relation, there are two tubes, that is the trachea and the esophagus, two muscle, inferior constrictor and the cricothyroid muscle. Two nerves, that is the recurrent laryngeal nerve and the external laryngeal nerve. Trachea, esophagus, this is the recurrent laryngeal nerve, which is present in the tracheoesophageal groove. Now coming to the posterior relation, remember, it is by the thyroid sheath and its content. Now coming to the blood supply, remember, it is supplied by superior thyroid artery, inferior thyroid artery and the thyroid ema artery. Superior thyroid artery is the first branch of external carotid artery, which is divided into anterior and the posterior branches. Anterior branch supplies the upper part of the isthmus also. It is closely related to external laryngeal nerve. While as the inferior thyroid artery arises from thyrocervical trunk, which in turn arises from the first part of the subclavian artery, and it is the major blood supply for the parathyroid gland, that is the inferior thyroid artery. Now coming to the thyroid ema artery, arises either directly from the arch of aorta or brachiocephalic artery. So thyroid ema supplies the isthmus of the gland. Surgical ligation of superior and the inferior thyroid artery is done close to the gland. Remember, it is done close to the gland. Away and near concept is gone. Now coming to the venous drainage, it is drained from the four veins, that is the superior thyroid vein, middle thyroid vein and the fourth vein of Kocher, that drains into all these three veins drain into the internal jugular vein, the internal jugular vein joins with the subclavian vein to form the brachiocephalic vein. The inferior thyroid artery drains from the isthmus, joins the brachiocephalic vein. Now coming to the isthmus is related, the upper border of the isthmus is related to the pyramidal lobe and the superior thyroid artery, while has the lower border, it is related to the inferior thyroid vein. And the thyroid ema artery.